Hello po! Today, I am going to perform bed bath. So first, inform the patient and explain the procedure. So hello po, ngayon po tayo po ay magbe-bed bath upang guminhawa ang iyong pakiramdam. Then, wash his hands and prepare the following materials. Place with reach. Then, line a chair or a table with the newspaper or a piece of rubber or plastic sheet. Then, basin with warm and tap water. Soap, body lotion or talcum powder. Then, bath towel, wash clothes or face towel, linen, then patient's gown or clothing, bath blanket, and bed shampoo set, and perennial care set. And then, provide privacy and screen the bed if in general ward. Then adjust the temperature and ventilation of the room and remove unnecessary article on the bed. Then clean up the working area. And then lower the back and knees. Rest depending on the condition and comfort of the patient. Then loosen the top sheet. And replace with bath blanket. Assist the client or the patient in the side of the bed with supine position. With the head placed in the edge of the bed. Then, remove patient cloth under the top sheet or blanket, bath blanket. So, if IV present, remove gown from arms without IV first. And slid the IV bag or bottle and tubing through the sleeve and Rehangs. Then, check flow rate and regulated as necessary. Fill the bath basin with 1/2 to 2/3 full of comfortably warm water. Then, spread bath towel across the patient chest. Put on gloves. Shampoo here if necessary. Follow procedure and bed shampoo. Then change water as necessary. Wet the wash clothes or face towel and squeeze out the excess water. Then wrap the wash clothes around the palm and the finger. To form a mitten. Then, wipe eyes from inner to outer canthus using single stroke. So, inner to outer canthus. Use separate side of the cloth for each stroke. Then, rinse wash clothes. And using circular motion, bat the face, neck, and ears. So, I will using 3 stroke. Rinse. Then repeat. So, from here, 1, 2, then 3. So, for this stroke. So, from forehead, papunta sa kanyang pisngi. Diretso sa kanyang tenga. Doon, dito yung tenga niya. Then, leeg. Then, rinse. And, sa other side, from forehead, going to the other side na kanyang pisngi, papunta sa kanyang ears. Then, na kanyang leeg. Rinse as necessary, then patted with the towel. Remove bath towel from the client chest and place lengthwise under the arms away from you. Then, wet. Use long, firm stroke from digital to proximal. Then soap. Pay particular attention to the axilla. Use long, firm stroke from distal to proximal areas. Then, rinse. Do the same strokes. Then, dry. So, make sure na matuyo nating mabuti ang kanyang kamay, kilikili. And did the same with the mirror arm. Place the basin on the towel near the edge of the bed and immerse client's hand in water. Then wash hands and pay particular attention to nails. Then rinse and dried well. Then change water as necessary. Then place towel over the chest and abdomen. With one hand, lifted edge of towel away from chest. With mittened hands, wet chest and abdomen using long, firm strokes. Then, soak chest and abdomen using long, firm stroke. Then, rinse. Same stroke. Special attention to skin folds under the female client's breast and umbilicus. dry chest and abdomen. So, para sa safety ng ating patient, siguraduhin na itaas natin yung bed rails. Then, assist the client to turn to side with back toward the nurse. Then, spread the towel on the side close to body. Expose the entire back. Wet from the nape to posterior upper thigh using long, firm strokes. Soap. So, did the same stroke. Then, rinse from the nape to posterior upper thigh using long, firm strokes. Then, dried. Rub back with body lotion or talcum powder. So, depending on the client's preference and skin condition. And turn the client's back to dorsal position. And change water as necessary. Then, expose the thigh, leg, and foot on the far side. Dropping a portion of the top sheet or blanket around the groin. And flex the knee and place the bath towel under the entire leg. Then, wet down to the ankle, giving particular attention to the inguinal and popliteal areas. Use long, firm stroke from distal to proximal. So, using same stroke, use long, firm stroke. Then, rinse. Then, pat dry. And did the same with the leg nearer you. Then, lifted foot and lowered it slowly into the basin. And so if the basin is big enough, both feet may be washed at the same time. So, sabunin natin. Then, change water as necessary and rinse well between the toes. Then, do the same on the other foot. And then, pat dry. So, make sure na madry nating mabuti. Then, change water as necessary. Flushing or follow the procedure in perennial care. Then, remove gloves. And dispose the gloves. Then, assist client in putting on clean gown or pajama with IV. Then, with IV bottle in your dominant hand, place the non-dominant hand through the sleeve of the clean gown from the distal end towards the proximal end of the sleeve. Then transfer the IV bottle to the non-dominant hand with the clean gown on it. Use the dominant hand to slide the sleeve on the clean gown over the IV bottle. Then down the IV tubing and over the client arms and replace the IV bottle on the IV stand. Then and slide one arm through the other sleeve and tied gown. Then check the IV flow rate and IV axis site to ensure IV is still intact and patent. Then assist in hair care. For female, the client may prepare to wear light makeup. In occupied bed. Then assist client in a comfortable position. And discarded dirty linens into hamper, observing universal precautions. Then clean, replace, and return the used equipment and Keep the unit in order. And then, wash hand. So, that's all, ma'am, for my demonstration of bed bath. So, once again, thanks po and God bless you po.